Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and to delve into the challenges and impact each technology has in practice. This is the Medtronic MedEd learning experience. The BIS monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. Reliance on BIS system alone for intraoperative anesthetic management is not recommended. Medtronic's medical education programs are offered to provide attendees education on the FDA-cleared indications and use of our products when applicable. The contents and conclusions of the following program are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers received funding from Covidien LP, a Medtronic company, for the speaking engagement. For this segment of the series, a discussion on anesthesia in the brain, we will dive into what triple low means. To help provide insight on this topic is Dr. T.J. Gann, Professor of Anesthesiology and Distinguished Endowed Chair at Stony Brook University.
I'd like to turn to another area which I think of critical importance and is often underappreciated, and that is the degree of hypotension and hypertension during the anesthetic. One of the first earlier study that point to the fact that hypotension may indeed be bad for you in post-operative outcome came from this triple low study, where they looked at over 20,000 patients' anesthetic record. And they found that if you run a mean arterial pressure less than 75 millimeters of mercury, in addition to that, your BIS value is less than 45, and your MAC is less than 0.8, you tend to have a much higher risk, almost 4 times the risk of bad outcomes. And this is mortality. You tend to have a 4 times increase in mortality if all of these 3 variables are met. And this is what we call the triple low state. Now, since then, there have been other studies have replicated that, essentially suggest that low blood pressure, low BIS, and low MAC are associated with a bad outcome. Now, if you just take blood pressure alone, so this is a study that looked at intraoperative hypotension. What is the relationship of that and post-operative stroke after general surgery? Now, you will find that the odds of having a stroke within 24 hours or within 10 days tend to go up when your mean blood pressure drops below a threshold of a percentage of baseline. And increasingly, we find that if the mean arterial pressure is below 65 millimeters of mercury, that is associated with post-operative bad outcomes. So let me share with you a number of studies that shows that. So this study looked at intraoperative mean arterial pressure and post-operative outcome in terms of acute kidney injury, cardiac complication, and myocardial injury. And this graph demonstrates the duration of hypotension. So this is the mean arterial pressure less than 65 millimeters of mercury. If you spend over 20 minutes of hypotension as defined by mean arterial pressure less than 65, you're also developing complications, whether it's acute kidney injury, cardiac complication, or myocardial injury goes up substantially. And the injury is a function of the duration of hypotension. Another study that was published from the Cleveland Clinic data again shows that the 30 days mortality goes up substantially if your mean arterial pressure is less than 75 for more than 10 minutes. And you can see that arm goes up substantially of the 30 days mortality in the presence of hypotension. Another similar study again shows that there is a cumulative effect of hypotension. If your blood pressure falls below 65 millimeters of mercury, your odds of developing myocardial injury goes up substantially. Now, there have been a number of studies that also show that, on the other hand, if your blood pressure goes up, intraoperative hypertension are also associated with bad outcomes. So it suggests that we should try and keep our blood pressure within a fairly narrow range during surgery, because hypotension, mean arterial pressure less than 60, 65, is associated with bad outcome, and hypertension also is associated with bad outcomes.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.